everyone, and welcome back to #CRArthritis from the Arthritis Podcast Network. I'm Isabelle Troïtzky. I'm with Arthritis Consumer Experts and the Global RA Network. And I'm joined by Dr. Neda Amiri. She's a rheumatologist and director of Pregnancy and Rheumatic Diseases Clinic in Vancouver. And I think you're just coming from a workshop that was given here at the annual scientific meeting of the Canadian Rheumatology Association and Arthritis Health Profession Association in Quebec. And that workshop was about from egg to the baby, supporting women with rheumatic disease in their reproductive journey, so a busy program over these 3 days and ending with a workshop. How did you feel about that meeting?
It was really good. Thanks for having me here. Yeah, we just wrapped up the workshop and I was lucky to have that workshop and do it with Lori Peru and Mary DeVera, who I think actually interviewed earlier.
And Lori is a patient.
Lori is a patient, so it was really nice to hear the patient perspective and how she went through her reproductive journey, and I think really the audience appreciated it as well.
Okay, so can you talk a bit about yourself? So what you're doing in the clinic?
So I'm a rheumatologist by training, and so I trained at UBC, and I spent a little bit of extra time after I finished my residency training in rheumatology with Dr. Carl Laskin in Toronto. So shout out to him, and the OTIS organization, so Organization for Teratology Information Specialists, and they're based out in the States. And then I returned to BC and I established our Pregnancy and Rheumatic Disease Clinic at Mary Pack Arthritis Center, and we've been running that clinic since 2017.
Okay, so women who come to you, so I get they're referred by their rheumatologist, and because they told their rheumatologist that they're planning to have a baby, I guess. And so, what's the process, and then how do you work with your patients?
Yeah, great question. So the referral can be initiated in multiple ways. So sometimes patients know about me or have heard about me, so they go to their rheumatologist and ask the question. But sometimes the rheumatologist thinks this is a good patient to have a consultation with us. We also accept referrals from obstetricians, other internal medicine subspecialties, so respirology, and sometimes even the family doctors. So, and it's been interesting, sometimes we get referral from obstetricians because they see the patient has a flare of their arthritis, or they're presenting with arthritis for the first time in pregnancy or shortly after delivering. So we see that type of patients as well. And I guess the second part of your question was, how do we work with the patient? So the conversations that we have, in an ideal world, we would like to see the patients before they're pregnant. So, the stakes are low. We're talking about the future, so it's lower stress environment as opposed to showing up pregnant where, the patients may not be on medications that they feel comfortable with. So we try to do a pre-pregnancy consultation, lay out a roadmap in terms of what medications are considered safe in pregnancy, because that's usually question number one that comes up. Are there any barriers to getting pregnant? Should they not be getting pregnant? What can they expect their disease to do in pregnancy? And that can vary a little bit disease to disease. Is this something that they're going to pass on to their baby? So all very valid questions, obviously, as parents to be. So we try to address those questions, and then once the patient becomes pregnant, we kind of become the rheumatologist and follow them through their pregnancy. We do a postpartum visit, and then they go back to their treating rheumatologist. Those are for the patients who are mostly in the Lower Mainland, but we do serve the province. So even if patients are, in Prince George or somewhere in the interior where they're not able to physically come down, even before COVID, we were providing phone or telemedicine consultations, and we work with the rheumatologist and provide information and counseling as patients deem it necessary.
So, do you know of any other clinics across the country?
Great question. So, there are a few clinics. So, the founding father of this, again, I've alluded to him, is Dr. Carl Laskin. So so he's in Toronto, and he's been doing this for a lot of years. In Alberta, there's Dr. Sarah Troster, and she's based out of Edmonton, and Dr. Stephanie Keeling, who also has an interest in this area. Obviously in Quebec, there's Dr. Evelyn Binet, let me see, in Ontario, there's also in Hamilton, Dr. Victoria Pavlova. Those are the ones that I know about, but I know in Montreal and Quebec City, there are also obstetrical medicine, internal medicine specialists. I know some of them because they train with us and they've come back. So that's another resource that's available, but we're hoping to expand pan-Canada.
Yes. No, it's very important, and lots of questions, I guess, when you become a parent. Anyway, there are tons of questions.
Absolutely.
And then when you're a woman and you have a rheumatic disease, all the more. And so I was wondering if it's kind of the chicken and the egg. Does pregnancy, bear a risk, for the disease, and does the disease, impact the pregnancy?
So absolutely, this is an area of ongoing research, and depending on the disease, the answer may or may not be very straightforward. So we know a lot more about how rheumatoid arthritis or lupus behaves in pregnancy compared to, say, myositis or systemic sclerosis, which is why research in this area is so important. But something that we've learned from research in RA and SLE is that how patients enter the pregnancy and what their disease activity is like at the beginning of pregnancy is very important, because that's predictive of how they will do in pregnancy, and then how you do in pregnancy can be predictive of how you do postpartum. So the ideal scenario is that the patient's on pregnancy-compatible medications, they're doing good for 6 to 12 months before pregnancy, minimal dosages of prednisone, because we love prednisone, but we also hate it because obviously a lot of side effects associated with it. And then the patient enters pregnancy in a low disease activity. We monitor them, follow them, and then they deliver with low disease activity and maintain that. And having low disease activity is important, obviously, both because of the health of the mom, and because parenthood is hard, let alone having an arthritis flare, but also having low disease activity and systemic inflammation in mom is important, because that has been shown to correlate with pregnancy outcomes. So especially RA and again, lupus research shows that women who have flares in their pregnancy, patients who enter pregnancy with higher disease activity, those are women who are more likely to experience pregnancy complications. So that can include delivering prematurely, having babies who are on the smaller side, having hypertension in pregnancy. So having low disease activity and having optimal disease control is important, both for the health of mom but also the baby. So that's a message I think everybody should know about.
Great advice out there, definitely. And so, other than through your clinic or the other doctors you mentioned, is there information out there?
There's a lot of information out there. Unfortunately, not all of it is sound information, as I'm sure you know. So I would just like to caution patients about what they read, and not always trust resources that they read on Facebook and some forums. So obviously CAPA is a great patient-related resource, rheuminfo.com, so that they also have some pregnancy information on there as well. Otis also, I mentioned they're American-based, but they have information sheets on medication, or what's called fact sheets on medication, so patients can refer to that. But I think the important thing is, again, the patients shouldn't wonder these questions by themselves, Googling in the middle of the night on the phone, because I know that's something I do. So you have these conversations with your rheumatologist, with your healthcare provider, with their obstetrician, and if they don't know the answer, they can refer you to someone who knows the answer. So this is a difficult question and difficult decisions for patients to make, coming to parenthood, and we want to provide the best available evidence and information and be part of their shared decision making, essentially.
Yeah, that's great advice. Any question from the viewers?
Do you have any insights on partners who want to support their wife or partner in the reproductive journey and arthritis journey?
Yeah, so they're at least about half of the equation, so we encourage them. Actually, they're kind of fundamental in making it happen. So we do actually encourage them in BC to come to the clinic. At the very least, it's always nice to have 2 pairs of ears, because there can be a lot of information that comes at you. So and then again, I find moms or mom-to-be's can be very selfless, and then having the partner there is nice to have a soundboard as well, and they can volunteer some information and be part of that decision making. So I would actually encourage all the parents to come to these appointments with their partners. Great question.
Mm-hmm. Anything else? No? Well, thank you so much. Anything else you want to share?
No, thank you for giving me this opportunity. Yeah, start the conversations early. Mm-hmm. So even if you don't think you're going to be a parent for another couple of years, it's always nice to have the information at the beginning. Have the information repeated. Repetition is nice. I know it takes a few times for myself. And this is something that we work with our patients and try to make it happen for anybody who wants to have children.
Yeah. Okay. Well, great. Thank you so much for your time. Thank you for your advice. It's a very special area, and happy we addressed this today. Thank you all for watching #CRArthritis with ABN, and we'll see you soon for another interview.